This presentation is focusing on ethics in radiological protection for medical diagnosis and treatment. And this is the work done under the ICRP Task Group 109. So the task group is under Committee 3 and Committee 4 of ICRP and is aimed to present the ethical aspect in the use of radiation in medicine. It is addressed to the radiological protection of patients, intended for medical professionals, but also for patients as a public and authorities, and it is based on the ICRP work already done with the publication 138, which identifies the core ethical values and procedural values associated with the system of radiological protection. Note that the occupational exposure and the research exposure to ionizing radiation are not part of this task group, since its group is dedicated only to radiation protection of patients. Here we have the members of the task group 109. So the draft of the reports aimed to introduce the core ethical values and procedural values in the context of diagnostic radiology and radiation therapy, to increase the familiarity of professionals with ethics foundation of radiation protection, and moreover to help to integrate ethical consideration in radiation protection in medicine. Then we have these 2 points that are well relating one each other, that is to promote an evaluation method to analyze the specific situation for the ethical point of view, and present scenarios where clinical teams face ethical challenges. So we know that the core ethical values underpin the system of radiation protection were already identified in the publication 138 as beneficence, non-maleficence, prudence, justice, and dignity. And moreover, the aspect of relationship with the 3 principles, justification, optimization, and limitation, has been evidenced in the same publication. Now we are going about this relationship of the 4 core ethics with the 3 principles related to the medical field, but with attention to the fact that we are dedicated to the patient, and so only justification and optimization, and not taking care about limitation. So beneficence is indicated as to promote or to do good, and no maleficence to avoid doing harm, and the beneficence reflects the principle of justification, and no maleficence, the principle of optimization. So both are key values of the biomedical ethics and have a fundamental role in providing medical and societal benefit through the use of ionizing radiation. So prudence, making informed and careful considered choice without a full knowledge of the scope and consequences of the actions, is related to both justification and optimization, and prudence is related to the consideration of uncertainties regarding radiation risk in both the situation of deterministic effect and stochastic effect, and also associated, as we well know, to the linear not ratio model as a prudent basis of radiation protection. So for justice, fairness in the distribution of advantage or disadvantage, it reflects the optimization principle, in particular in a medical field with the patient vulnerability and the patient need to benefit for medical procedures. Regarding dignity, the unconditional respect for every person deserved, irrespective of personal attributes and circumstances. Dignity support right to know, informed consent, and it is related to the procedural ethical values. The proceeding ethical values are recognized at the level of the ICRP 138 as, for example, the accountability procedural ethical values that people, but also organization and institution who are in charge of decision making must answer for their action to those who may be affected by these actions. And then transparency related to openness about the decision and activity that may affect society and also economy and the environment. So important point is the communications that have to be clear, accurate, honest, in a complete way. And in the medical field, it is implemented, the transparency, according to different procedures. For example, through the training of workers and informed consents in case of a patient, we well know that is have been developed already times ago in the biomedical ethics. Then inclusiveness, so the involvement of all the relevant parties, as we call sometimes as in general, not sometimes as stakeholders in the decision-making process related to radiation protection. And in the medical facility, it was evidenced very effective the inclusiveness, both for the occupational and for the patient exposure. And it's open a discussion within the task group regarding the need to extend the set of values, in particular considering the solidarity, so the common good as mutual recognition. And support, since solidarity is well known and understand in the medical field, as also sustainability as the good of for future generation, as for example maintaining a healthcare system for the public. Empathy is related to inclusiveness, contribute to understand the patient perspective in decision-making process. And precaution is related to prudence, but taking into account to prevent or to reduce the risk for which we have no direct scientific information, and autonomy related to dignity and also to stakeholder participation and empowerment of individuals. So the task group introduce the scenarios where clinical professionals, but patient also public, face ethical challenges and promote an evaluation method to analysis. We can talk about a strong compliance, a weak compliance, or non-compliance. We noted that sometimes when we think about one value and see that, okay, for that value the compliance is strong, this is viewing a perspective. If we changes the perspective for the same situation and the same value, we can see no, the weak compliances. And this is not a problem because it opens the discussion within the participants of this analysis. The scenarios are drawn from aspect of dilemma in diagnosis and in therapeutic practice. And we can start exactly with an example, very short example, that is Mary Jane, a 39 years old mother with a little baby of 1 month and a half. She's a single mother. She was prescribed to have a procedure of nuclear medicine. The information is that radiopharmaceutical use is known to have low activity concentration in milk, so no interruption of breastfeeding is required, and she is very happy about this. However, after completing the exam, she received a leaflet with instruction to limit close direct contact with the little baby for 12 hours after the scan. She is surprised and concerned since she is not prepared to pump her breast milk and does not have any person in this moment to take care about Jack. So the example shows the importance of addressing the need of patients, not only with respect to recognize benefit and harm, but also with respect to the practicalities, with taking into account the personal situation, concerns, and point of view. And here we have the evaluation, taking into account the four core values, beneficence, normalificence, and prudence, together with precaution, justice, and autonomy, together with dignity, and then the procedural value, transparency with accountability and inclusivity, and we add empathy for these. Compliance with respect to beneficence and non-maleficence, if we could take into account of the exams, is a good compliance. But thinking that the situation creates anxiety and concern to the patient, there is a weak non-compliance to be taken into account. Good compliance for the prudence, but in any case, we have to take into account that family environment is not always the same, so we need attention to possible diversity, and equity should be part of the information process. So we have to take into account of the respect for dignity of a patient and patient living situation in a structured modality and in proper time and so on. So we can say that, as we already know, that science, ethics, and experience are the three pillars of the system. So scientific facts are essentially to understand, but alone are not always enough to decide what to do. So ethical values are the other ingredient to be considered together also with experience. So core values and procedural value have been evaluated in ICRP 138, and the relevance of core values in radiation protection in the context of health care is taken in the draft of task group 109, also in ethical analysis for dilemma practices. Thank you very much and take care of ethics in radiation protection in medicine.